two-dimensional modeling showed that children and smaller adults might absorb more radiation than larger adults. And this was scalar modeling that has now been superseded, done by Om Gandhi in 1996. So Professor Gandhi, with whom I'm collaborating now, updated his work in 2002, here showing you that a smaller adult head here, you see the amount of exposure is quite similar, but because the head is smaller, it will absorb proportionally more. More recently, we have been working with colleagues at Porto Alegre with Environmental Health Trust, and we have developed three-dimensional modeling with anatomically based models using MRI to create the models with 1 millimeter voxels. And what we have done is to show the difference in radiation dose in heads of different ages and sizes. And I'll just show you one example here, coming from our colleagues at the Swiss National Institute of Technology, the ITIS, which have produced some of the most brilliant work in the world in this field. And they have shown here, of course, that there is going to be greater exposure, absorption into a younger head versus an older head. This is another item from their website of target tissue dose for the infant with using a system called the virtual family. Is there anyone here who's worked on the virtual family? Right. It's a really powerful and very sophisticated system that is used today to set standards for medical devices and surgical procedures, but it's not used for mobile phone standards. I find that odd. And I want to show you an example of some of the work that we are doing now that I'm releasing here for the first time. And this is a modeled microwave radiation dose of a 6-year-old with greater levels to the frontal and temporal lobes, eyes and cheek. And watch this here. Now, yellow, white, and red are the hottest, all right? And if you look carefully, you will see it's going into the eye, the nose. Do it again, just so you'll get to see it. And partly into the brainstem. Now, that's just showing you that there's going to be some exposure into that area of a young head.